All right, guys, we are going to start the ovarian chapter, okay? There's basically only one thing that's really tested on your part 2, and that's going to be PCOS. Why? Because there's a lot of different hormonal changes and diagnostic criteria. So, 1, PCOS. What are your symptoms? So, PCOS is polycystic ovarian syndrome, okay? What are your symptoms? 1, either amenorrhea or irregular menstruation, all right? You are going to have hirsutism, obesity, acne, diabetes. Why is this occurring? It's occurring because of the changes in the hormones. Now, when a patient comes to you, they're going to say, Dr. August, I've been having this really weird abnormal menstruation. Generally, this patient is going to be obese. They're going to have hair on the sides of their face, maybe even a mustache. They're going to have extra hair everywhere. They're going to say, listen, Dr. August, I have this abnormal menstruation, okay? When you see that, you are going to do a pelvic ultrasound. Your diagnostic test is going to be a pelvic ultrasound. However, you're also going to do a couple of other tests. Why? Because your pelvic ultrasound, if you see no cysts, does not mean the patient doesn't have PCOS. So, this is not the only test. You are also going to test for hormones like LH, FSH, testosterone. But Dr. August, it's a female. Why are we testing testosterone? Well, because PCOS has an elevated testosterone level. Why do they have an elevated testosterone level? Because they have increased androgens, which causes them to have, increased testosterone, and then that's why they can have the hirsutism. All right? So, pelvic ultrasound may show bilateral ovarian cysts, string of pearls is like that key word. However, just because this isn't pregnant, is not present, does not mean she doesn't have it. You're going to also test for the LH, FSH, and testosterone. Now, when you have, I'm going to explain to you, androgens and obesity. Why? Because your estrogen, when you have a lot of obesity, estrogen is produced in the fat, which is outside of the ovaries. Okay, when you have increase in your estrogen, it then increases your LH, and then therefore decreasing your FSH. You are actually going to have a 3-to-1 ratio, LH to FSH. Okay, so that's why you test it, and your ratio will be 3-to-1. That's a diagnostic criteria. Okay? Treatment. How are you going to treat this? All right. Treatment of ovarian PCOS is going to be weight loss. All right. You want to have the patient do diet and exercise and lose weight. Why? Because weight loss will decrease the fat, which decreases the extra estrogen production outside of the ovary. All right. What else? OCPs. But why, Dr. August? Because, think about it, if you now regulate the estrogen and the progesterone, you're going to actually decrease the androgen. All right? And this actually will help prevent endometrial hyperplasia. You can only give this to women, obviously, who do not want to conceive. Now, women that want to conceive, you're going to give them clomiphene and metformin. Clomiphene will help induce, to help stimulate for your eggs and will help your fertility. And metformin is going to decrease your insulin resistance. All right. So that's your main things for your PCOS. You're going to have amenorrhea, irregular menstruation, obesity, hirsutism. You have an increase in your testosterone. Your LH-FSH ratio is 3:1. Pelvic ultrasound will also show multiple cysts bilaterally. However, that is not the only diagnostic criteria. Treatment for PCOS is going to be oral contraceptives, weight loss, clomiphene, and metformin. All right, guys, we will see you in the next chapter.